There is no doubt in my mind that food systems are failing to provide children with the healthy diets they need, the nutritious, safe, affordable, and sustainable diets they need to grow healthy.
The organizers of today's meeting have joined forces to work on an urban food and nutrition agenda that fits for children.
As we leave behind the year 2020, not a good year for humanity, 2 in 3 children under 5 are not getting the minimum diets they need to grow healthy, to grow and develop to their full potential. Therefore, the need for diets, for services and practices that support good nutrition has never been greater.
We need to intervene early to promote good health, and the earlier the better.
The exposure to marketing in urban areas is enormous. I'm actually quite glad that the WHO Lancet Commission mentions commercial marketing of harmful substances as a threat.
Urban food consumption already accounts for 13% of greenhouse gas emissions in the world's megacities. By 2050, 80% of all food produced in the world will be consumed in cities.
Millions of people leave the countryside for urban areas, and as they do so, they disconnect themselves from food production. Placing children and their best interest at the heart of our advocacy efforts can actually mobilize public opinion, civil society, and public policy successfully.
The first thing we did in our work in London was to go and try and understand the reality of lives of children by tracing their daily life. We understood so much better about the multiple determinants, food environments, but there were also what was going on in their homes in terms of lack of income, psychological factors, desire to belong, social factors, and all of these intertwine in the context of children's real lives. That was making it harder for them to be healthy.
We're trying to hit obesity by food systems, but also by taking the same approach, so this systematic approach, the systems approach to integrating this with physical activity and sleep in children, getting our children to grow up more healthily, and with regard to overweight especially.
Amsterdam and Quezon City have taken significant strides to integrate food and health into their urban systems. We hope that the lessons learned can inspire other cities and other city leaders to take action.
We would like to see a cities collaborative emerge across the world. International reflection, I think, will be critical moving forward.
How do we work with businesses and how do we work with the private sector? And then how do we work with young people?
Leadership matters. Through strong alliances, I think we can actually achieve more and drive that joint advocacy where we will see the results, and politicians who make policy will actually decide on those policies.
I think there's an opportunity here to build a really powerful movement of young people in cities around the world.
And the most important thing we said in anything when working with young people is having a feedback mechanism in place.
Politicians and adults should try to give young members of the society, young people, a voice and a platform to express that voice, because we know the problems that surround us on our daily basis, and we have ideas for the solutions, and how can we express our voice and our opinions about that.
It's all about connection and connectors and co-creating so that we deal with our challenges. It's a conversation where context is important and change is critical. But at the center of all of this, we have to have the youth.